This is Voices of Public Health, the JSI podcast.
This is the Voices of Public Health, the JSI podcast, and I'm Penelope Riseborough, here today with Folami Harris. Folami is currently leading the Dreams Innovation Challenge project at JSI, and welcome.
Good to be here, Penelope.
Thank you. I know that the Dreams project is focused on building the agency of girls so they can protect themselves from HIV and other things. Why do you think that now is the time for an initiative like Dreams?
I don't want to say the time has passed. It has been now for a very long time. So that it happens in this moment is a good thing. We're very happy to see that girls are getting the attention they need. Interestingly, even for staff, we have a very hard time convincing our audiences, including staff, that girls deserve unique, focused attention.
Why?
The feeling is, what about the boys? Are you leaving the boys behind? Why don't they have access to these opportunities as well? So a challenge is trying to explain that normal means advantages for males at whatever age, and that it is not a bad idea to focus some very unique resources and attention to traditionally, historically disadvantaged groups. And in this case, girls.
Right. Interesting. Very interesting. And how do you feel that the work of Dreams is helping girls?
I think we're beginning to change mindsets to the extent that even the service providers have difficulty focusing on girls legitimately. We're seeing echoes of oppression in not only the girls that we're trying to reach, but in the very people who want to help them. We are guilty about helping girls just for the sake of helping girls. We have to help boys in order to justify the attention we give to girls. Isn't that something?
Yeah. So changing the mindset of service providers, as well as, I assume,
The
families
yes,
themselves.
Yes. And in a way, this is a parallel to what we're going through here in America. We're addressing issues of historical racism and disadvantagement. Calls into question, are you abandoning white people? Are you forgetting about their interests? This is the same kind of reaction we have with girls. So it is an uphill battle to the point where we're finding that we almost have to relax a little bit our exclusive focus on girls because it is seen as anathema to the interest of boys, and not that we can advance both.
Interesting. World Education, JSI's partner organization, implemented a project called the Ambassadors Girls Scholarship Program in 13 countries, and by the end they were including boys as well. So they had the same issue 5 years ago when that project was going on.
Yeah. And it's not that boys should not be attended to, but we're saying that in order to redress a historical wrong, it is okay to set aside some special resources for those people who've been traditionally left out.
Yeah, absolutely.
Difficult message to communicate, although it seems so simple.
Right. And so how are you going about trying to communicate that and change those deep historical and cultural approaches?
I use whatever analogies I can. Okay. So for staff, it's important that they understand it so that they're not defensive or feeling guilty, communicating guilt. And it happens for a lot of them. I use the analogy of independence because in Africa, people can relate to that. And so I talk about differential trade preferences. I talk about differential treatment around development issues because as ex-colonials, they were excluded from a lot of these advantages. And so sometimes they're set asides to help a particular country advance. Do you say, well, what about the US? Or what about Europe? I try to use that analogy. And I use the analogy of race very often. I use affirmative action, and I try to talk about it in terms of affirmative action for girls.
Interesting. Wow.
Doesn't always.
Right.
Doesn't always sell Penelope, but.
But you feel like you're making inroads.
Yes, I feel we're making inroads, and I know for the girls themselves, we are making inroads. You should see them. The pride. You can definitely see empowerment without even having a real good definition of empowerment that everybody buys into. When you see these girls, you know they're empowered.
That's wonderful.
What you want is that to be lasting, beyond a feel-good experience, to the kinds of institutional changes that they need to be truly empowered. They feel empowered.
So what is Dreams doing to try to sustain that?
We're trying to educate the communities and the families in the first place so that they can begin to see equality as norm. We're trying to change the institutions themselves in very small ways. There are not a lot of grantees that are attacking institutional biases directly, but it is that sort of underlying understanding that schools have to have policies that are forgiving of girls who become pregnant, giving them a second chance, that schools have to be aware of the need for policies around sexual harassment between teachers and students. So we're beginning to do some of this, but it's kind of early yet to say, well, we have had such and such a school change their policy about admitting or readmitting girls who dropped out because of pregnancy. But we are seeing it happen.
That's good.
Thank you for listening to Voices of Public Health, the JSI podcast.